All right. It looks like this is a great time to go ahead and uh, to get started. So, welcome everybody to the COVID Town Hall today. Good morning and good afternoon. We have a full agenda for you today. So, I'm going to start by handing it over to Marco to provide some opening remarks.
Thanks, Danny. Can everybody hear me okay?
Mm.
All right, good, good, good. Good afternoon and almost noon, everyone. As Danny shared, I'm Marco Giordano, your CEO, and I thank you all again for joining us today. So I want to start us out by expressing my gratitude to each of you and to all of our staff across the country for your continued pursuit of excellence, while also ensuring that we keep each other, the people we support, and our families safe and well. I also want to thank our leadership and staff in Delaware, Connecticut, and Philadelphia. We've had several rough weeks as we've navigated the vaccine mandates in those areas, amidst staffing shortages and many other challenges and pressures. It's really taken a lot of diverse thinking and lots of creativity to move us up these mountains. I appreciate all that has been done. And while heavy lift still remains in front of us, I know that together we will do it excellently with our foundational value of respect for the dignity and worth of everyone leading the way. So thank you everyone for all of your efforts as we continue to navigate this pandemic together. So last week, our wonderful marketing department, shout out to Darlene, Diana, and Willa, posted a video on Facebook. And the video was about one of our programs in Women's Space Ardmore, or Women's Space Ardmore in Montgomery County, Pennsylvania. And the video reminded me of who we've been, who we are, and who we can be. And it also reminded me of our resilience and providing hope during this challenging time. So I thought I would share it here with all of you today. So enjoy.
Us girls have been kind of looking for an activity where we can all do together. I'm all about alternative ways of healing.
I think that vibrations and music make people react in healthy ways, in ways that they don't expect. So I think that it's gonna surprise some people in how they feel.
First of all, I want to tell you something. It sounds great. Everybody!
Keep yourself entertained because you're gonna have downtime in reality and you have to sit with yourself and your feelings. This place really teaches you how to go through that without using. When we're drumming, I think like a lot of the girls are able to use their emotions or feelings that they have been experiencing throughout the day and be able to like leave it all out on the drum.
Yeah.
Every day during the week, we definitely see drumming in our lives.
Take a break, relax. Take your hands out.
Spiritual, physical, mental, that perfect center that you find sometimes of peace and balance.
Lena, do this for me. Go like this.
I'm super happy that we are able to do this. I think it's really stress relieving.
Don't stop.
Definitely feel more happy when I'm done. Like an adrenaline rush, I guess, happens.
Welcome to the 23rd annual Valentine's Day.
We went up and did about a 10-minute performance, and we did really well. most of us were pretty, I guess you would call it suffering from stage fright. It helped us a lot with our social anxiety. Doing something like that in front of a whole group of people, I realized I could do it sober. The drums gave me confidence. It made me feel like I had an ability in and of myself.
All right, let's drum a little bit. Our pizza's coming. Here we go.
Although some of the girls have graduated on, we had 2 new girls, so it was really neat to see them catch on so quickly.
This drumming experience has helped me to move forward in my recovery.
Everybody play.
Just being active with one another and realizing there's other things to life outside drugs and alcohol, and we can have fun and live a sober life.
And like Kristen said, less talk, more beat.
I hope that video brings to you all the same as it did to me, a sense of hope at a time where we are very challenged. And if we can use some of the quotes and the words that we used or that we heard in the video, less talk and more beat. Wow, a perfect example of how music and our self-care routines can really heal us. So again, as we all continue to navigate the pandemic together and navigate the world around us at the same time, I encourage you all to take the time to care for yourself and leave it all out on the drum. So with that, I'll turn it back to Danny. And again, thank you all for joining us today.
Thank you so much, Marco. Yeah, that was a wonderful video and always encouraging to see just the amazing, meaningful work that's happening across all of our programs. So thank you for sharing that. So Sarah, if we can pull up the agenda again, that would be wonderful. Great, thank you so much. So I'll go through the housekeeping quickly, and this is the agenda for the rest of the day. So Brian is going to provide us with an update with COVID Corner. Then we're going to have Connecticut and Delaware mandate updates from Sean and Monet. We're going to then talk through some Philadelphia mandate updates. That'll include an update on testing from Sheena, an update on the furlough process from Alicia, and then Sandy will walk us through an update with temp agencies. As always, we'll move into our question and answer section of the town hall, and we will end with some closing remarks from Marco. So as a reminder, there are multiple ways that you can submit your questions during the town hall today. You have 4 different options to do so. So the first is to submit a question anonymously using your voice. Sarah's going to be monitoring that inbox. You can also send a question through the COVID-19 email inbox. You can also submit your question in the chat on Zoom, or you can raise your hand and unmute and ask your question that way on Zoom. So we'll go ahead and review this one more time before the Q&A, but want to make sure that everybody's aware there are multiple ways for you to ask your questions during our town hall today. So with that, I'm going to hand it over to Brian to give us an update with COVID Corner.
Good afternoon, everyone, and welcome to COVID Corner. With colder weather on the way, everybody will be spending more time inside, perhaps painting happy little trees, just like the one I have here. So here are a few things we should continue doing to keep ourselves, our friends, and our families and clients safe. Painting is good for the soul. Practice good hand hygiene. Wash your hands frequently with soap and water. We just want to stop that little virus right in its tracks. Oh, and remember to use hand sanitizer if soap and water is not readily available. Also, continue to sanitize surfaces with products that are approved to combat viruses like COVID-19. Also, remember to wear a mask at your office or program, regardless of your vaccination status. Everybody knows there's a big old smile under your mask. Keep socially distanced when possible. Make sure fleet vehicles are thoroughly disinfected in between uses. Remember to avoid overcrowding, and also remember to wear a mask if there's anybody in the vehicle with you. Also remember to avoid high-risk activities that may include being indoors in overly crowded, poor ventilated spaces with people from multiple households. Remember, outdoors is safer, and also plants and trees need company too. Especially this little guy here. So don't let your guard down, be vigilant, and we'll continue painting all winter long. Thank you, and stay safe.
So we're getting a lot of applause for COVID Corner. Thank you so much for giving us that update, Brian. That was amazing as always. So now we're going to move into some updates about the Connecticut and Delaware mandate. We're going to have Sean and Monet give us that update. So I'm going to hand it over to them.
All right. Good morning, RHD, and afternoon for those in Eastern time. I got tears, Brian. That was awesome. Great information. Well, I just want to take a little bit of time to give our folks an update on how the mandate is going in Delaware. For our mandate in Delaware, things are running relatively smoothly. As we initially rolled out the state mandate, we unfortunately had 2 staff that we lost to that process. The systems that have been put in place for us, though, have to collect both status and testing results are working well. The reports that we're getting from this data are currently going to both our regional directors and our program directors, which has proven to be super helpful. And they're forwarding that information on to our assistant directors as needed. And so what we're finding in Delaware is that the time that it's taken for testing results has increased due to the volume of testing since the mandate has happened. So we're taking a little bit more time to get those results back. However, with the reports and the manual follow-up, we're related to the testing turnaround. We continue to maintain full compliance in Delaware with the mandate. And when I talk about manual follow-ups, that just includes getting the documentation from folks if they haven't gotten their results back, but proof sent in and shared with our program leadership around the actual testing that's happening. So it's proof that our folks from our staff have gone and gotten their tests. I just want to shout out all of our regional director, Laura, the program directors and assistant directors that have done an excellent job managing communication with staff, reaching out, following up. We have a really good process where the reports are going to multiple folks so we can check in and make sure that everybody's following the protocol and the mandate as required. And that's what's helped this transition be successful. So appreciate that time. I'll pass it on to Monet.
Hi, everybody. So I'm going to do mandates for, well, not actually me, but Greg is going to give a mandate for Delaware IDD, and I will give an update for Connecticut. In Connecticut, we started a little bit earlier than everyone else. I will say that the team there has done a magnificent job. We had a little bit of a rough start in terms of getting people tested early on, but thank you to Bernie, we managed to make it happen. So we met all of the requirements in a timely manner. We have 79 people there who are vaccinated, and then we have 72 people who are getting tested on a weekly basis. So 72 people is a lot to manage and to have people upload into the system. And we've had a couple of challenges with uploading, but you know, we've had folks reaching out to IT to give them assistance with getting that done. Tommy has agreed to sort of do a consolidated report for us every week, which has been very helpful. Thank you, Tommy Suggs. I don't see him on the screen. I'm sure he's somewhere around. So right now we have one person who is not fully vaccinated, and he decided, you know, not to work until he did become fully vaccinated. And on a weekly basis, we maybe have to pull 1 or 2 people from the schedule, but otherwise everybody's getting tested in a timely manner. And Carmen and her team have managed that beautifully. It hasn't been without its challenges. So yay, Connecticut. All right, so Greg is going to give an update for Delaware IDD.
Take yourself off mute, Greg. Take yourself off mute.
Great, thank you, Marcos. So as I was saying, good afternoon. My name is Greg Richardson. I'm the Regional Director for Delaware IDD Services, and I'm certainly grateful for the opportunity to speak with our community as to where Delaware as a state is with respect to the mandates for unvaccinated staff. So I do need to say, and I think it's just helpful perhaps just to give a little bit of foundation to how this came about. So Delaware Governor Carney, roughly August of 2021, mandated an emergency regulation that states that all unvaccinated staff who are employed within the healthcare system, and again, healthcare system is a very broad continue, if you will, of which RSD, with respect to some of our services, do fall within that category. I would say that the process has gone quite well so far, but I do want to just give a little shout out to a number of people who have been very instrumental and helpful in working behind the scenes and on the scenes with us to pull this off, because it's a huge undertaking. Or that I will say we have had a tremendous amount of successes, and I certainly attribute that to the collaborative efforts from everyone. Again, under the guidance of our chief program officers, in this case, Brandon and Linda. Again, just to mention Bernie, Minay, Laura Marvel, who is on the behavioral health side, but also there had to be some coordination between our two systems. Laura Marvel, as well, as I said, also we have Laura Polis, who is our DD administrative assistant, and has done a phenomenal job in partnering with me in getting the information out to staff, and of course, Tommy Sugg. So what is the mandate for Delaware as it stands? So as I said, Governor Carney issued an executive order mandate that all unvaccinated staff as of September 30, 2021, must submit, to weekly testing every 7 days. And so the key here is every 7 days and not once a week. So of course, then it was very important for us to how do we operationalize this and get this information up to the staff in terms of informing and making sure staff were aware. We did a number of things that were very creative, very positive, and in that we had staff meetings on a regular basis to ensure that staff understood what the mandate was. We also sent out emails across our systems. We have a very large system to ensure that staff got the information. We also sent text messages as well separately to staff, because we wanted to ensure that everyone was as informed as possible. The other piece I would say about Delaware is, as a state, Delaware has been very transparent and making resources available for anyone who wants the vaccine to be vaccinated, and as well as those who need to be tested. And so there has not been a problem. Of course, as one would anticipate in any initial rollout, there can be some bumps and bruises, but by and large, anyone who wants to be vaccinated can be, as well as anyone who wants to be tested, understanding that the testing of those results must be uploaded and verified in order for the employee to keep working. So there's been a number of positives from that has worked extremely well. I do want to just kind of give down just some breakdown of numbers. So in terms of staffing, so within our IDD system, we employed about, when we fully staffed, about 120 to 130 staff. Of that, when the mandate went into effect, 3/4 of our staff population was fully vaccinated, which is a good thing. That speaks to the support of this team, making sure that information got out to the staff. Of that number, we had a very small percentage that had to result to weekly testing. And I want to kind of talk a little bit about that because it's kind of into facets. So we know that weekly testing is a requirement for those who are unvaccinated. So in terms of the number of staff who had to submit to weekly testing was about 1/4 of the remaining staff. Within that quarter, we had about a handful of staff, I would say, who either were in that kind of quasi-place position of getting fully vaccinated. And as we know, fully vaccination means for Moderna and Pfizer, the 2 shots and 14 days out, right? And then for the Johnson & Johnson, 1 shot, 14 days out. So although those staff are in the process, which is great, those staff still had to resort to the testing every 7 days to maintain compliance. And knock on wood, a tremendous amount of staff have already met those requirements and are now fully vaccinated. So there were really some positives from this process. I think just the program making sure that as information was shared with us, that those information got shared very timely with the staff. The state also has been tremendous in giving information and resources. So we know we have the curative sites, and I will now board the group about what those are because we've discussed them in the past. DPH has a number of sites that are throughout the state. Most of those locations do not require appointment, but are walk-ins. Also, those have been a tremendous resource for staff to become vaccinated, as well as we have our local, of course, pharmacies like the Rite Aids and the Walgreens, and those two have been a major source of resources, if you will, for staff to be vaccinated. So all in all, things are going extremely well. We did have to, by the way, unfortunately, remove a very handful of staff who could not, for whatever reason, meet the 7 days testing weekly. But as those staff met compliance, they were then brought and reinstated back to the active work duty. So that is the pretty much the summary that I have presentation to be present on behalf of Delaware IDD. I do want to say that the regulations, though, refers to and applies to Delaware IDD residential, the mental health group homes within Delaware under the RHD umbrella, but it does exclude the ACT and ICM programs. So thank you so much for the time to speak with this group and give updates in terms of where Delaware, specifically on the IDD side, is with respect to testing the mandate.
Like it should. What does like?
Thank you, Greg. We appreciate it.
Yeah, thank you so much, Greg, Minay, and Sean for keeping us up to date on what's happening in Connecticut and Delaware.
I don't know.
As a reminder, if we can all mute, thank you so much. All right. So now we're going to move into a conversation about some updates with the Philadelphia mandate. So first, I'm going to pass it to Sheena to give us an update about testing.
Hi, everyone. Happy Monday. So for Philadelphia folks who are required to get tested, and that is those who have approved exemptions and those who are not fully vaccinated must get tested.
Recognize it. It's set
in Philadelphia. About 2 weeks ago, we sent out a spreadsheet that we got from the city that listed sites you could visit, sites all over the city you could visit to get tested. We did get some feedback from some employees who reached out to us to let us know that they called this site or they went to this site and just gave updates with the process. So led by Tommy Suggs, thanks so much, Tommy, and with the help of Vanessa Williams, Jarrell Ferguson, and myself, we did update that spreadsheet. So we added some more tabs to give more information just about each site, what's needed when you go. Is it testing free? Is it covered by insurance? Is it a drive up or walk-in? What kind of testing is it? Like the swab testing, the short swab or the long swab? Do they offer rapid or PCR or both? Hours of operation. So we updated just some more information to those fields for everyone's convenience. In addition to how long, where we could, how long it takes to get test results back. So later today, we'll provide those in the Philadelphia area with that updated spreadsheet to use. In addition, please, if you're looking at the spreadsheet and you come across any issues, please make sure you reach out to someone, myself, your unit director, so we can make updates as we see them. Or if you have any information about other testing sites, let us know so we can update and spread that information to everyone. Just as you know, I know we heard that we've been hearing the word fluid so many times, but this situation is fluid. And as we are working, there's a group of us working on some other testing options specifically for RHD employees. So as we get more information, we'll be able to release those details. Let me know if you have any questions. You can email me, message me in the chat. And I think I'm going to pass it over to Alicia for furlough updates.
Hello, everyone. Thank you so much, Sheena. I appreciate that. So of course, if you are in Philadelphia, Friday was the deadline. If you are in Delaware, Connecticut, those deadlines were prior to that. I think that we've already heard from Delaware and Connecticut that there have only been about 2 employees. I think that's the number I heard. Holding all the numbers is kind of a little challenging as they are moving targets in so many different places that at least that I try to keep an eye on. But the numbers in those areas are pretty low. The numbers in Philadelphia as of Friday, in terms of what the deadline was, I am not clear about, but we have sent out the process. If you are a leader in Philadelphia and did not get the email last week with the furlough process, along with the actual change form that you are completing and the code that you are using for employees who are currently listed as not having a validated vaccination document or an approved exemption, then you should be using the furlough code and form that was sent to you last week. Those forms are due this Wednesday by 12 noon. This Wednesday by 12 noon. We need to have those change forms for each employee, so that it's each program and or department area leader or service line leader, whatever your role is, to have those and submitted to payroll to be able to process by 12 noon on Wednesday. And then also today, you should have received, I believe that the email, I always set these things to automatically send out. I believe that the email went out today for the furlough letter. There's a form letter to be able to get to employees. I haven't been able to check, Okay, so I'm seeing some thumbs up that letter went out. That is a letter to be using with employees who are being furloughed, unfortunately, through this process. Again, something that I don't think any of us enjoy doing, but there are times when we have to do things to be able to comply. I will say, and I would want to say this, that, I know that there are other providers throughout the city that are trying to also comply. And I just want to help all of the leaders on here to feel some level, though I don't think that there's any real true comfort in any of this, but the idea that RHD is only furloughing our employees to give them an opportunity. We're not terminating. I've seen some employees that are being terminated. I've also seen at other organizations and some employees that have been suspended at other organizations. That's the way they're choosing to handle this. And I think, again, RHD furloughing employees to give them an opportunity to maybe rethink and or get themselves compliant with this mandate, still covering their benefits for this 30-day period, I think is typical of RHD and what we try to do, even when we are in situations where, there's circumstances beyond our control. So I just wanted to make sure if you're not, if you are a Philadelphia area leader or supervisor, if you have locations in Philadelphia, you should be, and if you are in Connecticut or Delaware, you should be getting daily reports that identify your employee status. They come out every morning based on the information. I think if anything, there's maybe like maybe a little bit of a lag if an employee submitted information late, but they process overnight, and there shouldn't be any delay in getting that information as up to date as possible. And as of last week, we've also been sending those confirmations out to employees as well. But the managers have had them from day one and having that information on your daily manager report that comes from the content portal, the COVID content portal. So I'm hoping that everyone is actually getting those, opening them and reviewing them. They're really easy to understand. They kind of lay out who submitted as well as who has been reviewed and therefore confirmed. If there are any issues, we have had a couple of challenges, and our external party that is helping to manage this process is working through those things, but they're very few in number and compared to the number that have been submitted and reviewed and approved. So there's very few cases where there's anything that seems confusing or outstanding. So just wanted to kind of put that out there. If there's any questions, please put it in the chat. I know that there is a question around employees who do not live in a mandated vaccine area. If you are working in the Philadelphia sites, it doesn't matter where you are living. It's if you are working in a location in Philadelphia. And I see Sheena responded that accurately, highlight the emphasis of work. So if your work location is anywhere in the city of Philadelphia, barring a few maybe confusions on the list, the roster, or whatever the case may be that comes out and that we are using information in Lawson. Some of you have realized that you do still have inactive employees on your roster or employees who you thought you had terminated. You need to make sure that that information is processed, get those forms into payroll as well, to make sure that our records are as accurate as possible should they be audited. So keep up the good work, everyone. These are difficult times, but this didn't make it any easier, but it definitely is something where I think, as I heard Sean say, we're all pulling together, trying to pull together systems and process and doing the best we can in really challenging situations. So if there's any questions, please put them in the chat or use all the other resources that Danny identified at the beginning. Thank you.
Great, thank you for that update, Alicia. So the last update surrounding the Philadelphia mandate is now going to be Sandy giving us an update on temp agencies.
Danny, Sandy was unable to be with us today, so she's asked me to step in, share with you all what she had wanted to share. And, she would have done a much better job than I'm going to with this, and I would appreciate others to step in as necessary. But at the end of the day, we're working at a time that's unprecedented as it relates to staffing. And it is important for us to continue to be creative and how we engage temporary staff in the short term. And typically we will engage temporary staff as needed without any lead time in sort of to prep them for the work that ultimately we need to do. And given the circumstances that we're currently working within, whether it be the Philadelphia mandate, but just in general, the staffing shortages, there's an opportunity for us to engage temporary staff differently than what we have done in the past. And some programs may already be doing this. So kudos to you if you are. And that is sort of getting ahead of it and engaging and employing temporary staff before you need them. And then also using that time to orient, to train, in a sense, to create a pool of staff that will allow us to more effectively deploy staff when needed. So I defer to others from the team to join in and share any other specifics that you all feel might be important. But let's be creative and continue to be creative in how we engage temporary staff to be used in our workforce by increasing that lead time so we have staff ready to go when needed.
And thanks, Marco. And for the Philadelphia unit directors, we have a meeting later this afternoon at 4:30 Eastern Standard Time. And we can talk about that as well. Really looking, again, when you know a week or so ahead, you're going to need to have that staff to bring them in, as Marco said, a little bit earlier than typical, to make sure that we're grounding them and training them as best as we can to the practices. The only other thing that I would add right now is just, again, in our meeting, we're going to be making sure that we have information on all the staffing agencies that we use in the Philadelphia area at this time to make sure our list is complete and extensive so that we can be in conversation with them. So that would be it. I don't know if Brandon or Bernie have anything else?
Yeah, Linda, the only thing I would add is that we need to be conscious of the fact that temporary staff are not our employees. So we need the list of all the agencies we're contracting with so we can formally reach out and make sure that they understand in the mandate areas that what the mandates are, that they agree that they are following the mandates and only sending us staff that meet the requirements of the mandates. And that if we get audited, it would be at that point in time that we would reach out to them and ask them for the documentation. We're keeping documentation through a great system that IT has set up for us for all RHD employees, but we're not responsible for the documentation of folks that are not our employees. So temporary staff, again, we're just making sure we know all the temporary staff agencies we're using so we can formally reach out and let them know. We want to make sure you're aware of the mandate, that you're complying with the mandate, and that you will only be sending us staff that are in compliance with the mandate. If we get audited, we'll be reaching out for records.
Great. Thank you so much, Bernie, Linda, Marco, everybody for those updates. Unless there's anything else, that is our full agenda for today. So we'll kind of shift gears and go into our Q&A. I've seen some questions come into the chat. Just as a reminder to folks, so for those who are joining via phone, don't always see the chat. So we'll make a point to read the questions and the answers that have come in that way, just so all of us can hear them. So why don't we start off? Sarah, I'm going to start with you. Have any chat questions come in to you?
Yeah, Danny, I do have a few. Given short staff and upcoming furloughs, is consideration being given to allow vacation carryover with a must-use date of April 1st, like was provided last year? I think that's probably a question for Alicia.
Yeah, we are looking at that and we'll be discussing that actually today to look at the same thing we did last year or something other, but we are looking at that today.
Great. Let's go over to Mary. Let's take a look at some questions in the chat. Is there one that you would like to start with?
Sure. someone is asking, have we figured out what to do with our staff that are fully vaccinated but are missing lot numbers on their cards? This person has dates but no lot numbers. 2 are handwritten cards done at pharmacies, and 1 is a printout from Walgreens or from the Walgreens app that shows dates and type of vaccine, but no lot numbers.
So I can take that from a process perspective. I believe probably within the last few weeks, we said and informed staff that they can reach back out to the source of the vaccination. So wherever they got vaccinated, they should be able to reach out and get that information. We've been asking them to do that they want to make sure if they needed a replacement card or if they needed something, if something was missing, reach back out to that Walgreens. They should be able to provide that information to you relatively easily. As they have all of those records at their pharmacy location. So again, we're asking you to reach back out wherever you received your vaccination, reach out and ask them to provide that information for you so that you can enter it.
Thank you. Okay. Someone has asked, I haven't seen the Delaware statute. Are there provisions for medical or religious exemptions? So this was actually answered in the chat, and someone said, we do not have a medical or religious exemption situation in Delaware because you have the choice to be vaccinated or get weekly tested. I'm not sure if there's more follow-up to that. Okay, I'll keep going. Testing is a challenge, as we all expected. Are staff required to upload proof of their tests since results are often taking 3 to 5 days to receive? We don't want to have to furlough people who actually are testing, but just not receiving their results yet.
I think this is a very fluid situation, as we've been saying all along, and we're learning stuff. As your staff are having difficulties getting their test results, it would be important that they reach out to their immediate supervisor and the divisional staff, and then we can give directions sort of on an as-need basis as we see what the delays are going to be. We certainly don't want to furlough people that are paying attention to the rules and are just not getting the results beyond their own control. So reach out to your supervisor and divisional staff, and we'll have to do that on a case-by-case basis.
Bernie, the only other thing that I would say, again, reaching out to the supervisor to talk about, is it a particular site people are going to that's having a delay? Maybe we know of some sites that are getting testing back quicker, maybe testing a little earlier than we thought, so the result can come back, within that week time period. So lots of different things that we can try to make sure we are in compliance with that mandate, but reach out to the supervisor, regional director, and service line director to try and talk through that.
Great, thank you, Linda. And I think Brandon had something he wanted to share. Can we make sure that he can unmute Sarah?
Thanks. Now, Bernie ended up covering it. I just couldn't unmute, so I appreciate you making it so I could unmute. I apologize. It was locking me out. Thank you.
Not a problem. We just wanted to make sure you were good to go. So thank you for checking in. Okay, Sarah, why don't we go back to you? Are there other questions that have come in on your end?
Yep, I've got more. So the next question I have, and I just want to say, sorry if I'm repeating a question. I'm trying to do stuff on the back end, so I'm not always paying attention to what's asked. So now that the booster shots have come out, will we need to resubmit our proof of vaccination form with the new booster information?
Pop in here for a second. So the definition of fully vaccinated has not changed right now to include the booster vaccines. When an updated definition of what fully vaccinated means includes the boosters, then yes, but we are not there right now. It's just the 2 doses of Moderna and Pfizer or the 1 dose of J&J.
Thanks, Emily. Danny, I'm going to ask a few more if that's cool.
Yep, that's great.
Someone asked if shared services managers should be getting the reports about vaccination status.
Alicia, I'll take that if that's okay. So executive team members provided the email addresses for who on their team should receive the reporting. If you are a shared services manager and think you should be getting the reporting, you should speak to your executive team person.
Thanks, Tara. Someone asked, what happens if they are unable to upload their test results by 12 a.m.?
So there might be more than one of us to, who might answer this, but we do have the, if it's Delaware, it's once a week, Connecticut once a week. So if people aren't within that week, they would need to be pulled off of the schedule. So if it's a question of, we talked about before, a delay in getting results, we have to look at different providers who are maybe able to get the results quicker to us. But if it's just somebody has not gotten to, they have the results and they haven't uploaded them, that's a different issue entirely.
Thank you, Linda. Danny, I've got a couple more. I can just keep going if that's cool.
Yeah, why don't you keep going? That'd be great.
Sure. So someone asked we're requesting that people double mask if they've gotten an exemption. And folks are asking what type of masks are required for double masking.
Hi, everybody. So if you're going to double mask, it would be 2 surgical masks, or you could use just 1 KN95 mask. But the double mask should be 2 surgical masks, or can be.
Thanks, Emily. I'm getting a couple more questions in now. Will new hires be given medical and or religious exemptions? I'm assuming they mean the opportunity to get exemptions. I assume the answer is yes, but I'll let Alicia.
Right, at this time, we are requiring in areas that require the vaccination. The vaccination. So in Philadelphia, we're requiring that new hires are vaccinated. We shared this in our FAQ. There's been language that has changed in our postings or should be changing in our postings that indicate the vaccination requirement, as well as the new hire paperwork updated with an attestation of vaccination. Upon start, a new employee will be required to upload their vaccination information within 24 hours. So that would be that process. We would not, right at this point, be looking or offering exemption opportunities just because there's no way to guarantee that an exemption will be granted for a new prospective employee. We could go through the whole process and then hire someone and then they not be given an exemption because they don't meet the requirements. And so at this point, again, we're requiring vaccination. That information has been placed in postings. This is something that's not new. Other employers across the industry and across the country are doing the same in other industries as well, requiring vaccination in advance and making sure that people are aware. Just like any other requirement we have for employment, we post that information on the posting so that people understand what the requirements are before they apply for the job. And so again, as someone mentioned the federal mandate, we're probably going to see this more and more. We've seen it, but we're probably going to see it even more across the country and across industries.
Okay, thank you, Alicia. All right, I'm going to hand it over to Mary now to go through some of the questions that have come in the chat.
All right. How should we handle staff who do not upload their required test results? Can we inform them that they can't be on the schedule until they follow the procedure, or do we have to wait until they have done it twice in a week? So this was answered in the chat. Sheena says that she has this outlined in the Philadelphia testing protocol. So I guess you can reach out to her if you need that. When will they start mandates in other areas?
We're keeping our eyes on that. It's a great question. We wish we knew that, but the goal is to be proactive and start taking measures as we progress through it to make sure, again, our staff and our consumers are safe. So we do have the system, as most of you are aware, the online tracking system. So we've asked employees across the organization to log their proof of vaccination into that system already. So we're trying to prep for it so we won't be under the gun like we were in Connecticut and Delaware, where we might only get 2 weeks notice to enact a mandate. While that's completely unreasonable, unfortunately, our funders and legislators often ask us things that are completely unreasonable. So our goal is to be prepared and proactive as we approach other states and operations in those states. We do have our ears to the tracks, trying to make sure we are ready to inform you as soon as we get information if a state is moving toward mandate or a funder is moving toward mandate. In addition to the federal mandate that many of you are probably reading about and seeing in the news from the Biden administration, that is progressing. So we would likely see some federal mandate at some level in the very near future. So we'll keep you updated as we have more information to share. But great question. Thank you for that.
Thanks,
Can I
Brandon.
just add one more thing? I'm sorry, Mary, just add one more thing. I would encourage people to really hear what Brandon is saying, which is if you're already vaccinated and you have this information, go ahead and submit it so that you're not waiting until the last minute. I know that just in general, we have so many things going on in our lives that we might miss the emails and the communications, and then a deadline is there, and before you know it, we're all in a rush situation, no matter how far ahead we try to communicate these things. So I think, again, as we see and we track, and if you're paying attention to it, you're watching it happen outside of our HD, just go ahead and put your information into the portal. And that way you don't have to worry about facing a looming deadline, and or encourage your staff to do so that you're not facing a looming deadline that potentially could have significant ramifications on your program, your ability to staff, your ability to provide quality services. So earlier is better than waiting until the last minute and then waiting to get some type of verification or validation of your documents. So get it in as soon as possible if that's, I just encourage people to do that.
What is the possibility of sharing nursing staff amongst RHD programs?
So that is a possibility. It has not been our common practice to do that because usually we contract for the amount of nursing we need in any given setting. But as you know, through the pandemic and now also through the mandate, it is something that I think we need to take a broader look at in sharing staffing, especially specialized staffing across programs.
Thank you. For religious exemptions, why wasn't the option to upload documentation from a religious institution? Is there an appeal process for religious exemptions that have been denied?
Okay, so the mandate requires the statement of deeply seated religious belief. Did not require us to have someone verify that they belong to a religious institution or wasn't related to any one particular faith or denomination. So it wasn't about, hi, I belong to this particular institution or I have this particular faith orientation. That wasn't what the mandate was for. So we did not require that because there's no need to verify that you are part of a religious organization. It was specifically related to a deeply seated religious belief related to the vaccination and your religious faith. So again, that wasn't required and we didn't need to have that, and we didn't ask for anything more than what the mandate required, more than what the statute required. In terms of an appeal process, we have not allowed for an appeal process. Unfortunately, again, this is a situation where we are wanting to make sure that we are fair and consistent in terms of our process to all staff. And so we're not in a position to kind of like allow people to keep trying to get the statement until until we hit the right statement. So again, it's related to a deeply seated religious belief. The instructions seem pretty much referred that they're pretty clear from people. Ask people, encourage them to be kind of straight and to the point and pretty succinct related to what their belief is in terms of the vaccination. So that's where we are.
Thanks, Alicia. Is it possible to provide an updated list of approved nursing agencies ASAP since the holidays are coming up?
Well, we had talked about getting all of the temp agencies, some of which specialize in nursing, together and available, because we also, for multiple reasons, one of them, we want to make sure we're in contact with each of them around mandate requirements. The other is to be able to be sharing amongst the different teams that are seeking nursing. So yes, we'll be able to at the, probably this afternoon at the Philadelphia unit directors meeting. We may have that. If we don't have it this afternoon, we should have that tomorrow that we can share out.
Thanks, Linda. What do you say to an unvaccinated person that has now been exposed to COVID 3 times in under 30 days by 3 fully vaccinated people?
I can pop in here for a minute. I think this is a really great opportunity to look at if the COVID protocols are being followed, because that is the first thing that sort of popped up into my head of, if we are following these COVID protocols, masking at all times. Actually, Bob Ross told us earlier, right? Let's follow what Bob told us. If we are following these COVID protocols, that is the person really exposed? That would be my question. If we are truly following the COVID protocols that have been set forth so succinctly by our risk department.
Thanks, Emily. One other thing that I would share is if to raise that to the regional and service line director level for a particular site where there has been that much exposure or activity, to take a look and just make sure that all of the protocols are being followed, and is there anything other way we need to support that particular site?
Thanks, Emily and Linda. As a way to ensure that agencies are following our mandates, is it a good idea to ask the temporary staff upon their arrival to RHD sites to simply provide a copy of their vaccine card? These copies can be held in a folder at the site.
No. I don't know. I'm trying to add a little levity. So, agency staff are employees of the staffing agency that we are contracting with. They are not RHD employees. And so that is why we want to make sure that we have clear communication with all agencies that we are using for staffing purposes of what the expectation is. If in fact an audit was to occur, those staffing agency records would be audited at the staffing agency site, not RHD. We don't want to begin treating agency staff as if they are actually RHD employees, the same way, independent contractors or anyone else. So again, I think Linda mentioned, or someone mentioned, getting the names of all of the staffing agencies that we are using to us so that we can ensure that we have appropriate communication and clearly established expectations between us and the staffing agency providers of what the process that we are expecting them to hold when it comes to their employees that they send to us as agency contractors, temporary contractors. So again, we do not want to collect or hold or screen or in any way staffing agency employees for COVID vaccine, because they are not RHD employees, and we then open ourselves or put them in a different category legally once we do that. So wanted to make sure that we all understand the answer is no.
And if I could just chime in for a second, Alicia, just to give support to what you just observed and share, which is quite correct. Delaware DDS took the very same, or has taken the very same position as well, that and because we too contract with the temp agency to assist and meet our staffing deficit. And the very same was discussed that the agencies, the staffing agencies to whom we may use employees from to fill our staffing deficits, those staffing agencies are indeed responsible for the mandate and not RHD. And so if those staffing agencies were to be examined, it would not be RHD being examined, but those staffing agencies, because they have to comply with the very same mandate because they're part of the healthcare continuum providing those services. You're quite correct.
Great. Thank you, Greg. Thanks, Alicia, also for your no song at the beginning. Thank you, Emily, for the nod back to Bob Ross, our very own Bob Ross. We're going to pass it now back to Sarah to see if any questions have come in to her.
Got a couple here, Danny. So I'm not 100% sure I know what this person is asking, but I'm going to ask it and hope that folks can help interpret. Do employees need to wait until they have received approval of vaccine information uploaded into Okta, or just the confirmation that it was uploaded?
Validated submission and approved exemption. So validated submission of your vaccine information, which again will be on your manager's report, has been on your manager's report. So if you've not gotten, for some reason, we started that communication last week directly with employees, but you always have the ability to check with your manager to identify whether or not your approval has come through. So again, that is going to be your most immediate source. But right now, at this point, exemptions are being reviewed. We have a 24 to 48 hour turnaround from when they're submitted to when they're reviewed. But just wanted to kind of put that out there so that everyone's aware of the timeline that we're working with. Now that we've gotten through most of the backlog initially, we have a 24 to 48 hour turnaround. But your manager's report should show you, if you have not gotten your email, whether or not your vaccination documents have been approved, or if there was some issue in terms of either the wrong document. We've had the wrong document being uploaded. In one situation, we've had the lot numbers not be there, a name miss, whatever the case may be, and or the card not being legible because it was cut off or something like that. So we've had that communication, and I am getting the email saying I'm gonna leave 24 hours is now the turnaround time. I see 24, but I'm not sure what the 24 is. That 24 hours, which is now the turnaround time instead of the 48, because we've gotten through most of that backlog. And what we're looking to do at this point is 24 to 48 business hours, right? That's what I said. Okay.
Thanks, Alicia, for that real-time update. Things change quickly. But yeah, I appreciate that, Alicia. Thank you. So I want to go back quickly to, it doesn't have to be quickly, but I just want to go back to some questions about double masking. And the person wrote, I just want to confirm for clarity, we are allowed to wear one N95 mask instead of double masking. And will programs provide these masks?
That is a perfectly good option for masking. And I will throw it to Brandon and Linda about the supply.
So I would say we have gone through different cycles. Every program is supposed to have a 3-month supply of masks on hand. We have said that and said it. So hopefully all programs have that. Some people prefer their own masks. Some people want to come in and use cloth masks or different types that they want to purchase. That's okay. But we also have masks on site that staff can use. I do not think every program has the N95 masks on site because early on we made a determination of where those needed to be used and where they did not need to be used. So that is something I can take back and clarify, but I don't think every program has those on site for everyday use.
That would be the case for IDD as well. So appreciate you sharing that, Linda.
Great, thanks so much. So we're going to go back to Mary and go through some more questions in the chat.
I have staff that are having difficulty uploading their cards. Is there a way that someone can upload them for the staff or send in their vaccination card?
So we have had, in terms of the vaccine portal, we have had managers or someone else upload if staff have had a difficult time. Again, that's why we're telling people, make sure you connect with your director. It's as simple as, you know, taking a picture, but maybe there's some technological challenges on certain phones, whatever the case may be. So ultimately, at the end of the day, we'd ask staff to connect with your program leadership or your department leadership related to getting that for you. We know that there have been some managers that have uploaded it for them because we can, you know, see the emails that come in and know, you know, we have one email sending in multiple forms. And so we know that they're probably uploading it for someone to help them out. So definitely, again, connect with your program or your department leadership around, or your service line leadership if you are having a difficult time with getting the technology to work for you. Please, I will make one disclaimer. I had a couple people send me their vaccination cards. I won't even open the file, and I won't be able to give you any validation that you can use to continue to work. So you must upload that into the portal. Please don't send that to myself or anyone else.
Yeah, I just want to make a quick note. We actually got a couple in the COVID mailbox. So I just want to piggyback on what Alicia says, that it has to be done through Okta. We literally cannot do anything with the ones that come in any other format. So
thanks, Sarah. I didn't even know that they were coming to you too. I know Tara and I have been talking about it. So please make sure your staff know. I know it's in the emails that have gone out, but I know that sometimes people don't get all the way through it and they maybe panic and act prematurely and just go ahead and send it in a reply. But we want to make sure that we are managing, and we've said from the very beginning, people's information, and wanted to make sure that we don't just have, you know, employees' information all over the place. It's not a violation of HIPAA. If you ask someone to upload it for you, you have to worry about the HIPAA violation. So want to make sure that Marco's even gotten a few. Please share with your employees. So Marco, you know the struggle is real. Please, please, please share with your employees that when they're uploading, they must upload. They can have you help them as a manager, but sending all their information all over the corporation is not going to help them meet this mandate. So again, it's very important that they're not just receiving this information via the emails that are coming out, and that you are taking the information that you are hearing and you are paying it forward to them. So please, I beg you.
I would add one thing to that. Know that the validation email that your record has been successfully uploaded will go to the email address from which it is submitted. So if I ask my supervisor to help submit my card for me, then the validation email will go to my supervisor. It will not come to me. My supervisor can then share it with me. But you know, we've had some folks get some assistance and then get a little anxious when they did not get the validating email.
Correct, Bernie. And to that point, when we realized that we had someone submitting multiple, we went and made sure that we put the actual name of the employee on the email. So even if you've gotten 5 emails, it should give you the name of the employee. So that way you know which person's validation you are receiving back if you've submitted multiples in order to help someone out. So just wanted to make sure that's a really good point.
All right. We have a staff who is still under her maiden name with RHD, but her medical card, she is covered under her spouse's last name. So when she uploaded her vaccine card into the system, it was rejected due to non-matching names. What is she to do to get in RHD's system?
Absolutely. That's not anything new. Luckily, that is simply having the employee submit or their manager submit a change request to payroll, and their name and the documents that go along with that would be changed in our LAWSON, which is our formal employee information system, our HRIS. and we'll change them within the RHD system so that we can have accurate reflection of their information, not just with this, but across the board with anything that might change to reflect their married name. You wouldn't have that disparity, that difference. So yes, they submit the change form to payroll as quickly as possible, and that should reconcile the two. We do have a few that are name differences in name. Some situations, someone used a hyphenated name and another one they didn't. So we have a few of those, but they are very few that we are actually trying to work with. I think it's about 20 to 30 that we are actually trying to work through the name, making sure that we have correct or understanding of why the names are different. So yeah, and when yes, correct, Betsy, when you submit your name change, you have to include your documentation of that. So, you know, your certificate, marriage certificate, any of those things that have resulted in your name change, your ID, social security card, those kinds of things. So
thanks. What about programs purchasing government-approved rapid testing kits to accelerate turnaround time?
So for the testing options, right now, home testing using rapid kits, that is not part of our protocols. When Sheena had mentioned, others had mentioned that we are exploring additional testing opportunities. That may or may not be part of the answer that we create. So we will keep everybody posted on that. But right now, just using a rapid test at home is not something that is that we are using for approved testing.
I would only add further, before any program would contemplate going out and purchasing additional tests of any kind or doing that you would work through your supervisor, your regional or service line director, because we do have folks, again, a team of folks that are working on our testing options. And additionally, for Philadelphia, we do have the list of 95, but we've reduced that to a reasonable 70+ number of free sites that are available for testing. So we want to maximize those opportunities for our team. So we do have a team working on specific test availability outside of those options and would not want to do double work because we know everybody is very busy at this point.
Yeah, and finally, I would just share that because I think it's important for folks to hear the why as well, in that we feel that it's best to ensure testing is done within a controlled environment, but more importantly, there is reporting requirements to the city for all results of testing that we need to make sure that we're able to effectively do that, and having staff do at-home testing will just complicate that reporting that we are also required to submit to the city. So I want to share some of the why behind our decision around at-home testing.
Thank you. What's the opinion on cloth masks?
Well, I'm going to bring us back to something that Linda said earlier. Really depends on the situation, the environment you're in. I would suggest if you have direct consumer face-to-face contact, that you are wearing your double masking or wearing an N95. If you're by yourself and not a lot of people around, I think a cloth mask would be fine. But I would really, I think protocols have been released about, depending on the activity and how many people you're around and who you're around, will result in different mask options.
Are current full-time staff able to fill in at other sites for additional hours?
Absolutely. The staffing shortage, the pandemic, staff is very hard. The only thing that we would ask folks to do is be careful of your own wellness program, so you're not working 24/7 whenever possible, and also make sure that you're as proactive as possible, because when you go from the site where you know everyone to a site where you don't, there may be medical challenges, dietary restrictions, and things like that. So make sure you have enough time to get appropriately trained when you're going to a site that's not your home site.
With that, if you're not offered that, please ask. So in Bernie saying that, appreciate that advice. If, sometimes we get in a hurry. So in doing that coverage, if you're not offered appropriate person-centered training for that ISP, for that consumer, please ask. It's your responsibility to also take that so we can work together as a team and make sure you're comfortable, that you're well-trained, because a well-trained staff is a safer staff for not only you and your peers, but also our consumers. So please take the time to ask if you're not provided that.
Thanks, Brandon. I see, Sheena, you have your hand up. Oh, here, I think we need to unmute you. Hold on for just a second. Let's see, Sarah, can we unmute Sheena? Do you have that capability?
I do, just give me 1 second.
So thank you, Sarah. So also a quick just mention, if a staff is coming from outside of the city of Philadelphia, meaning their program is in the county in Montgomery, somewhere else, then they're filling in Philadelphia, then the Philadelphia mandate is in effect for them. So they have to make sure that they have their proof of vaccination or an approved exemption on file before they come into that program to work.
Dina, it's a great point, and clearly it would also be appropriate in both Delaware and Connecticut. The mandates are all based on where you work.
Okay, just a few more. This person says, I know that we are now requiring vaccine cards or negative results 3 days prior to start of employment. Am I correct in shredding the vaccine card or results once I verify it has been uploaded to Central?
I would not recommend, maybe I misunderstood, but would not recommend shredding your vaccine card. That is your proof of vaccination. So you want to make sure you would not do that. Keep those for your personal records. Regarding any other testing, proof of testing, once it's been uploaded, I personally don't have a need for you to keep those for our programs, but again, it is your proof of testing. So that is your personal health information. And I would encourage you to keep that protected. Don't just toss it in the trash can for sure. I appreciate you saying shredding, because if you are going to get rid of it, you want to make sure you shred it before you do that. But I at this point, I think it'd be wise just to keep your information at hand.
Sorry, to clarify, this was copies of staff's information.
Yeah, we're not, I thank you for that clarification, Mary. We are not keeping hard copies of staff information and should not be keeping copies of that, nor asking for it. So that, yes, please shred that information immediately. We do not want to keep that information. And again, we have an electronic tracking system for upload that the employees will upload their own data. If they cannot do that, they need to seek assistance and we can assist with that. But we would not be keeping hard copies of any of that data. Thank you for that clarification.
Okay, this one says, I received an email from COVID Vax that said that the employee ID number entered for a vaccination card was incorrect. I've assisted quite a few staff members in uploading their vaccination cards. I have no idea who this email was referring to. I would need the confirmation code the email was referring to so I could have them resubmit with the correct employee number. Who should this person contact in order to fix the situation?
So I would tell them to email back COVID Vax, and then we'll be able to follow up on it from there.
Okay. Danny, that's it for questions for now in the chat.
Great, thank you. Have any last minute questions come in to you, Sarah?
Nope, I'm all good.
Okay. So if there are no other questions, we'll go ahead and pass it to Marco to offer some closing remarks.
Thanks, Danny. And wow, we've come a long way for sure. A lot of great process in place, as well as a lot of great thoughts and a lot of creativity at play as well. So I appreciate everybody's contribution today, asking questions and answering questions and helping us to stay on track and know what tracks to be on at the same time. I have to, and forgive me, Mary, because I may pronounce your last name wrong, but Mary Chihuahua, did I say it right? There you go.
Perfect.
She is our new internal communications specialist. Mary, I think this is your first town hall. And if it is, you were a pro. So thank you for all that you have done to get us through this hour and a half, as well as you, Sarah. Always appreciate your facilitation and coordination of our questions. And again, everybody involved, Danny as well. So I have a few announcements that I really want to leave us with, all very exciting. And the first is, I want everyone here to join me in congratulating 2 RHD legends on their retirement. So Susan Burnham, our regional director in Massachusetts, who's been with us for 26 years, and Sue Acklin, who is our unit director at RHD Lehigh Valley Act, which is a program, a behavioral health program here in Pennsylvania and Northeast PA, who has been with us for 21 years. Both are retiring this week. So a round of applause for these 2 legends, and really appreciate both Susan and Sue. I'm not sure if you're on the call here with us today, but both of all of what each of you have contributed to what we are today, to who RHD is today. So thank you for all that you have done. Thursday, we have our Trauma-Informed Care Speaker Series, COVID-19, Where Are We Now? From 1 to 3 o'clock. So I'm hopeful that many of you are able to join us this Thursday and join in the conversation as part of our Trauma-Informed series, Trauma-Informed Care Speaker Series. And finally, on Friday, we have our Fall Festival, which is our celebration of all things fall. It is a 70s theme. There is certain to be a lot of fun, a lot of activities and prizes, and that is from 12 o'clock to 1:30 Eastern Standard Time. So I'm hopeful that folks can join us on Friday as well. So with that, again, I thank you all for joining us today. Keep the questions coming. Keep any sign of hope in front of you. And I know that together we will continue to get through what we must do in order to keep each other, the folks we support, as well as our families, safe and well. Have a great day, everyone.